Hello, I'm Danielle Bonfelt with Hayes Medical Center in Hayes, Kansas. I want to talk to you about a few things you should know before your colonoscopy. You will have to do a bowel prep the day before your surgery, which includes being on a clear liquid diet. You will receive the bowel prep instructions on a handout from the Southwind Surgical Office prior to the procedure. For this procedure, you will be required to be NPO 8 hours before the colonoscopy. NPO means nothing to eat or drink by mouth, including candy, gum, cough drops, or chewing tobacco. Prior to your procedure, an anesthesia nurse will call you and tell you what medications to take the evening before or the morning of the procedure. We ask that you please follow their instructions and notify us of the medications taken once in your pre-op room the day of surgery. For the procedure, you will need to bring a driver over the age of 18 with you to the hospital, as you will not be able to drive for 24 hours after anesthesia. Once you arrive at Hayes Med, you will be checked in at admissions and then taken to your pre-op room in ambulatory surgery. Upon arrival, a nurse will review your health history and medications. The nurse will then obtain your vital signs and start an IV. An anesthesia provider will visit with you about anesthesia. You'll be given monitored anesthesia care once you are in the procedure room. MAC anesthesia involves receiving medications through your IV that will allow you to relax and drift off to sleep. You will be unconscious but able to breathe on your own. Even though you are asleep, you may remember hearing staff talking around you during the procedure. Your surgeon will meet with you before you are taken back to the procedure room. A nurse will take you to the endoscopy suite for the procedure, and this is where the anesthetic is given after you are hooked up to the cardiac and vital sign monitors. Once the procedure is over, you will be taken back to your patient room. Here you will have to stay for at least 1 hour to recover. Now that we have discussed items to know prior to your procedure, here are some things you should know before you can leave. To meet discharge criteria, you must be able to drink fluids without experiencing any nausea, vomiting, reporting pain is tolerable, and maintain stable vital signs. Your physician will review the results of the procedure with you prior to discharge. You generally will not need a prescription after this procedure. After a colonoscopy, it is normal to have some mild gas pains, such as cramping or bloating, as the physician puts air into your colon to visualize it better. You will be encouraged to pass gas or burp to help alleviate these pains. After the procedure, you can eat whatever you would like unless otherwise told by your physician. It is recommended to start off eating a light meal to minimize the gas pains and nausea. If you develop a fever, severe pain in your abdomen, or bright red bleeding from the rectum, you need to call 911 or go to the nearest emergency department. For any questions, please call Hayes Med One Call at 855-429-7633. Thank you.